So the lateral mobility of being a PA is, I think, what attracts a lot of people to it, just because you don't know what you want to do when you go into medicine. And I found after many rotations that I didn't like most fields of medicine, and then I found the NICU and I realized I really liked that one. But there was, of course, a study looking at this. So they surveyed over 120,000 PAs to see how many switched specialties. And in the first decade of practice, about 40% switched specialties at least one time, and then there was more that switched more times. And then again, in the second decade of practice, there was more that switched. So overall, it was about 3/4 of the PAs that they polled that ended up switching at some point in their careers. And interestingly, it says PAs practicing for 31 or more years had over 4-fold higher odds of changing specialties than PAs practicing for 10 or fewer years. So there is quite a large number of PAs out there that switch fields at least one time in their career. So having that flexibility is definitely appealing depending on what you want to do. Again, it's such a hard decision if you want to do PA or medical school, but I really think you have to try and see yourself in 10 years, where you want to be, what you want to do. If you have a specialty that you really like and you want to be the one making the most decisions and having the autonomy, then medical school is probably more of an appropriate route. But if you like different fields of medicine and you want to be able to go between the different fields, then PA is absolutely a wonderful route to choose.